this video on strengthening health systems in the wake of COVID-19 pandemic. My name is Josfrida Nyamvula, an emergency and critical care clinician and a COVID-19 champion. The objective of this video and reading is to understand how to strengthen health systems in the wake of COVID-19 pandemic. We could ask ourselves, what are health systems? A health system consists of all organizations, people, and actions whose primary intent is to promote, restore, or maintain health. The health system delivers preventive, promotive, curative, and rehabilitative interventions through a combination of public health actions and the pyramid of health care facilities that deliver personal health care by governments, private companies, NGOs, and many others. The action of the health system should be responsive and financially fair while treating people respectively. The WHO has created the health systems framework, which breaks down health systems into 6 building blocks. That is 1. Service delivery, 2. Health workforce, 3. Information, 4. Medical products, vaccines and technologies, 5. Financing, and 6. Leadership and governance. When health systems prioritize access, coverage, quality and safety, they are more likely to achieve the following goals. That is, improved health in equity and access, responsiveness, social and financial risk protection, improved efficiency. What is systems thinking? Systems thinking is an approach to problem solving that views problems as part of a wider dynamic system. It is proactive more than reactive. It demands a deeper understanding of the linkages, relationships, interactions, and behaviors within a system. By using systems thinking, those developing policy and interventions can anticipate effects and potential synergies. Using a system perspective to understand how health system building blocks, context, and actors act, react, and interact with each other is an essential approach in designing and evaluating interventions. It is especially imperative when designing interventions and policies for scale. What challenges the strengthening of health systems? Countries, counties, and communities want better outcomes and therefore require stronger health systems. Unfortunately, there is no one solution or formula that guarantees positive outcomes. Many health systems lack the capacity to measure or understand their own weakness and constraints. This leaves systems unmapped and misunderstood. As a result, interventions, even the very simplest, often fail to achieve their goals. A primary reason behind this failure to impact is the often unpredictable behavior of the system around it. That is, early intervention, from the simplest to the most complex, has an effect on the overall system, and the overall system has an effect on every intervention. For this reason, it is really important to design policies and interventions within the context of the health system. In the early phases of the COVID-19 outbreak, many health systems were able to maintain routine service delivery, in addition to managing a relatively limited COVID-19 caseload. Today, demands have surged in many locations, and increasingly, healthcare workers are affected by COVID-19 infection. This requires strategic adaptations to ensure that limited public and private sector resources provide the maximum benefit for populations. The WHO has released interim guidance in a document called Maintaining Essential Health Services, Operational Guidance for the COVID-19 Context. This guideline outlines the adaptations needed to keep people safe, maintain continuity of essential health services during the response to the COVID-19 pandemic. It mandates action from all 6 building blocks of health system. The guide suggests the following adaptations. That is, adjust governance and coordination mechanisms to support timely action. Prioritize essential health services and adapt to changing contexts and needs. Optimize service delivery, setting and platforms. Establish safe and effective patient flow at all levels. Rapidly optimize health workforce capacity. Maintain the availability of essential medications, equipment, and supplies. Fund public health and remove financial barriers to access. Strengthen communication strategies to support the appropriate use of essential services. Strengthen the monitoring of essential health services. Use digital platforms to support essential health service delivery. Thank you for watching this video. If you would like to learn more about systems thinking for health systems, we have included 2 optional follow-up readings. That is, Steps for Intervention, Design Using a Systems Thinking Approach, and Maintaining Essential Health Services, Operational Guidance for the COVID-19 Context.